Hello everyone, my name is Anthony Riley. Today is the 1-year anniversary of the first day Ohio medical cannabis patients could purchase legal cannabis from a licensed Ohio dispensary. I want to give everyone an update on where the program stands after 1 year in operation. I am calling this the good, the bad, and the ugly. Alright, so here we go. First, let's talk about the good things. We have 78,376 Ohio medical cannabis patients according to the most recent report from the state. 47 dispensaries are now open in the state of Ohio. 20 active licensed cultivators are now active in Ohio, and 16 active processors in Ohio are now active. We also have 3 licensed active testing labs in Ohio to test medical marijuana products. 590 licensed Ohio medical cannabis doctors. Prices for products have fallen a little bit. All right, so let's talk about some of the bad things. 57 dispensaries were licensed, so at least 10 are not open today. Because of this, many patients still don't have fair and reasonable access to Ohio medical cannabis. Out of the 32 licensed cultivators, 12 are still not operational. This keeps prices up in certain areas of the state. None of the patients have been given a reasonable explanation as to what the delay is. 43 processors were awarded licenses, but only 16 are operational. This keeps prices of processed products higher than it should be. The Ohio Medical Marijuana Patient Registry continues to be reporting some information incorrectly. As a result, patients have been advised to email one person. He is the only person being tasked with helping 78,376 Ohio medical cannabis patients. I personally don't see how that is fair and reasonable to put all this pressure on one person and expect them to be able to resolve and help that many people at one time. Patients continue to be confused and frustrated over how to keep track of purchases. The state of Ohio doesn't provide any reasonable access to patients' purchase history. Only a few dispensaries in the state are willing to print patients' purchase history. I want to thank the dispensaries that are doing this. I believe patients should be able to visit any Ohio medical cannabis dispensary and be able to get a printout of their sales purchases. Patients should also be able to access the information online. The data available in the patient registry is at times inaccurate and also not easy to understand for most patients, and it does not include any detailed purchase history. This frustrates me and many other patients that their local pharmacy or medical provider can access the purchase history information, but the patients cannot themselves access this information. Patients have expressed concerns regarding adverse actions taken by their providers and their medical providers regarding their use of medical cannabis. Let me provide a few examples. Taking patients off opiate pain medication contracts or telling patients they have to choose between medical cannabis or opiates. Refusing to prescribe either pain medication or mental health medications that a patient was already taking on a treatment plan. Using the false excuse that marijuana is the same thing as opiates. Part of the reason Ohio medical providers are doing this is because the Ohio Medical Marijuana Registry information is being managed and tracked in the exact same system used to monitor opiate abuse. I believe medical cannabis can help reduce the number of opiates people are using. However, keeping this data in the same system as opiates creates a negative stigma about the use of medical cannabis. Ohio, to my knowledge, is the only state using such a system to track patients' opiate use alongside their medical cannabis use. Many patients have also experienced unfair treatment with their employers. Some patients have had to choose between keeping their jobs or giving up their Ohio medical cannabis card. As of today, patients don't have any official way to have a meeting and medicate at the same time. It is strange to me that it's okay for people to take an opiate in public or in a group setting virtually anywhere, but you can only use your dry herb vaporizer at home. Patients should have access to safe spaces where they can go and medicate and get support and interact with other patients without fear of legal actions. Another concern is that many patients cannot get to the dispensaries due to physical limitations. Many are not able to walk or drive. Some people cannot see or hear. There are people who don't speak English. The state of Ohio has not done anything, to my knowledge, to address these concerns. We have also seen Ohio medical cannabis patients who are involved in a variety of court cases for different reasons have additional actions taken against them for having a Ohio medical cannabis card. I am asking the state of Ohio, why don't Ohio medical cannabis patients have any protections under Ohio law regarding being part of the state's legal Ohio medical cannabis program? Now I want to get to the ugly. Patients have various questions and concerns about the program. They're often referred to the Ohio Medical Marijuana Hotline for help. Unfortunately, this is only a call center of agents who can read information from the state's website. There is no follow-up for complaints and concerns. Examples of issues that get zero follow-up are as follows: seeds in the flower products, mold in the flower products, missing products or short products, unfair, impossible, unlawful behavior by medical providers, law enforcement, judges, and dispensary employees and other state employees. The state is holding an advisory board meeting every 3 months. I attended one of these meetings. Patients' concerns were not addressed, and patients were barred from speaking at these meetings. Patients were only given a small amount of time before the meeting to speak to the patient advocate, who isn't even a patient to my knowledge. Why does the state of Ohio Pharmacy Board have a person who is a patient advocate that isn't a patient to my knowledge, and they have stake in one of Ohio's medical cannabis companies? The state of Ohio selected an advocate who has not held any patient meetings to my knowledge. I have asked for a public town hall meeting. As of today, we have made zero progress in getting this set up for patients. There have been a variety of issues with the Ohio medical cannabis products. Examples are defective products, missing or short products, and recall products. Patients have been frustrated with the policy to address these issues. There is statewide confusion of the refund and return policy of Ohio medical cannabis products. Patients are told there is no refund policy, yet there has been refunds for Ohio medical cannabis products. I am aware of an internal memo sent to dispensaries regarding refunds, but no communication to patients regarding the refund policy has been sent out via the state's email system. As a result of this, Ohio growers and processors have been wrongfully attacked by patients on social media who believe they should get a refund for short or damaged products. Since Ohio growers and processors are barred from responding on social media, they have no way to defend or address these issues. Also, there have been attacks on patients on social media by employees of dispensaries without any consequence. We have seen patient advocates who are trying to help the program attacked on social media. There is no way for the patient to report this to the state pharmacy board or to Facebook. The state is allowing all of these medical cannabis products to the market, but they are not allowing processors to provide proper instructions on how to use these products, leaving Ohio medical cannabis patients confused and only resorting to YouTube videos that are made from content creators outside of the state of Ohio for guidance. The state of Ohio doesn't allow large-scale marketing for dispensaries, but allows medical cannabis doctors to put billboard advertising for their medical cannabis businesses right across the street from the Ohio State House. I don't see how that's fair. Many patients are still smoking cannabis even though it isn't legally allowed. The state has approved a handful of dry herb vaporization devices. However, they are not affordable. Plus, the state is not making the case as to why patients should switch to dry herb vaporization from smoking. Instead, many patients are confused about dry herb vaporization, often thinking it's connected with the vaping crisis. Patients are also frustrated they have to purchase a battery every time they purchase a vape cartridge. This leaves patients stuck holding a bunch of batteries, or worse, throwing them back into our environment. The state should offer to recycle these batteries at no additional cost to patients. Patients are also, another major concern is that patients' eligibility for indigent status. As of today, only medical cannabis patients can only qualify for this status if they get Social Security. What about all the other poor patients who get Ohio Medicaid, food stamps, and other public assistance, which is based on a person's income? Many patients who receive these public benefits have already been deemed poor or indigent by the state of Ohio. So why can't they qualify for indigent status? At the last advisory board meeting in Columbus, Ohio, the only thing they were concerned with was state employees getting access to the indigent status if they were retired and on a pension. This group isn't always indigent or poor. Many additional requests for adding qualifying conditions are not being taken seriously by the Ohio State Pharmacy Board. Some of these conditions are already qualifying conditions in other states with medical cannabis programs. Examples are depression, autism, opiate abuse, drug abuse, and anxiety, to name a few. Last, there is confusion about edibles. This falls into two categories, two different things. Number one, patients using dry herb vaporizers are left with vape flower known as ABV cannabis. This is 100% reusable byproduct of dry herb vaporization. There are many videos and devices that can be used to make cannabis from vape flower material, yet the state has banned this activity. Patients should just throw away the vape flower material when it can basically be recycled and reused. The state should be educating patients on how to do this correctly, and also provide a way for these things to be tested for potency. Patients are not being educated on cannabis edibles and their delayed effects. There doesn't seem to be any safety protocols in place. If a patient takes too many edibles, there is no warning label on the products to explain the delayed effects. So, as a medical cannabis patient advocate, here is what I want to work on with the state medical cannabis patients and license holders to improve our program. Number one, patient rights and protections. Number two, fair access to Ohio's medical cannabis by addressing the need for transportation to dispensaries or delivery services for patients who cannot leave home. A fair statewide refund policy for missing or short or defective products. Patient education for the entire state about medical cannabis. State Pharmacy Board needs to create a new patient registry system separate from the state opiate monitoring system with fair access to patients' purchase history. Simple policies and procedures that give patients the ability to address concerns with doctors, dispensaries, growers, and processors in a professional manner. Ohio medical cannabis patients need access to a 24-hour support line that can answer any questions regarding the following items: medical cannabis health concerns, legal concerns, registry concerns. These people should be properly trained in various areas. There should be access to nurses that are trained about medical cannabis, staff that can speak to emergency room staff if a patient is being denied pain medication because of their medical marijuana card status. Patients who need someone to talk to about their medical cannabis should have access to counseling. This line should also include staff who can speak directly to Ohio law enforcement officials if a patient has been pulled over in a traffic stop with legal Ohio medical cannabis products and the officer isn't properly trained on the laws for Ohio medical cannabis. The medical cannabis testing labs in Ohio should be available to general public, meaning that patients should be able to take homemade edibles and other cannabis products to be tested at an additional cost to the patient if they are concerned about safety of the products homemade, homegrown, or licensed products or otherwise. This would certainly generate revenue for the state and the testing lab, which I think will help provide what I think will help build confidence in the state's testing methods. Like our neighbors to the north, Ohio should be allowing out-of-state medical cannabis patients to purchase at our licensed medical cannabis dispensaries. This again is a missed opportunity for Ohio to recoup some of the money we are losing to other states that are allowing patients from anywhere in the United States with valid medical cannabis card to purchase licensed medical cannabis products. And last, Ohio's potency limits for a lot of its products are lower than other states. This forces growers and processors to find ways to cut potency of their product, resulting in less effective products. The state's dosing isn't reasonable for patients because it sets daily limits based on days instead of grams. Each patient has different tolerance than others, so what works for a few patients may not be enough for other patients, forcing those patients to purchase the max amount allowed in the program, and then it still not be enough. Then they are out of days and forced to turn back to the black market, or worse, head north. Again, this is hurting the program, not helping it. I am sure there is more to add to this list, but I think these are the most important issues I get the most feedback about. I look forward to working with state lawmakers, the pharmacy board, growers, processors, and most importantly, the patients to improve the Ohio medical cannabis program. Thank you for listening to my speech. Thank you to the entire Ohio medical cannabis community for supporting me through all my health concerns. My main goal is to help patients get relief, hopefully to help fight the opiate crisis at the same time by helping patients have an alternative option to get relief. Thank you. Have a nice day.